Today, our discussion is how dismantling the ACA will impact veterans' health care, and we have an esteemed panelist who is our partner, and Adelena Marshall. She's a VA employee and mental health RN for over 30 years, so she knows her stuff. So we're going to talk about the ACA and how this will impact veterans' health care. Welcome, Adelena. How are you today?
I'm well, and thank you for this opportunity for NNU to reach out to our veterans. I'd like to thank Cliff Kelly, Glenda Smith, and certainly you, Dr. Colonel Dr. Arnold, for inviting me to join in this roundtable today. I would like to bring to the attention of our American citizens the impact on overturning the American, the ACA, as we all know, is Obamacare, the Affordable Care Act, the impact that it would have on our veterans who are not fully vetted in the VA, who, for whatever reason, may or may not be able to get care through the VA. Some are by choice, some don't qualify, as may be surprising to many of our Americans. Some who were employed outside and had private insurance coverage and have now possibly lost that coverage due to the loss of their jobs or COVID-19. And the other thing that hasn't been addressed is that these veterans, many of them have pre-existing conditions. And if by chance the Affordable Care Act was overturned, many of our veterans would not qualify under any circumstances to be covered under private insurance due to their existing injuries or other health issues.
Oh, boy. So, you're in the behavioral health arena, but this is also physical health, right? So,
right, physical health.
Yeah. You usually see a mind and a body connected, right? We have a tendency to separate those two.
No, they're all connected.
So how is the COVID environment right now affecting the behavioral health aspects? I've been hearing a lot about, telepsychiatry and psychology and, mental health services being extended over the telehealth system. But if you're living in an area where you don't have access to adequate, telehealth services or, connectivity with the Internet, those kinds of things, it could be a challenge as well. And if you're a homeless veteran, that could be even worse, right? So,
right.
So what are you seeing right now as far as our veterans from the behavioral health side?
Well, our veterans are isolated. Many of them are fearful of even seeking care in the hospitals because they're fearful of contacting COVID. Many of them who are homeless are at a greater chance of becoming infected with COVID and still will not seek the care that they need. If they are uninsured, underinsured, or not connecting to the VA, they are not aware of where they can seek treatment. The VA does offer our veterans very good mental health care. We're the only ones that offer talk therapy. Their medication can be provided free of charge to the veterans. We do a lot of follow-up care for our veterans. But for our veterans who are disconnected, lost through the system, who have not reached out to the VA, many of them, their families are probably not even aware that they can get mental health care at a VA. This poses a big problem.
Oh, yes, absolutely. So how do we reach out to those veterans that need that service? Or sometimes you have family members who are involved in this kind of area. We had previously Rory Clark, who's an attorney who actually is working with the Legacy Elder Law Center, who's one of our partners as well. And, he's mentioning that, there's some advantages, some things that people can do, and that sometimes the family has to step in because especially when people have mental health issues, is there anything that, family members can do to help to get the veteran to the table, to start entertaining some of these benefits?
Well, I think shows such as this, educating family members of what's available to their veteran family members, calling the VA, learning about the programs that the VA does offer. They can go online. They can check online at some of the VAs that are closer to the city. If they're outliners, they can also go online and find out how the VA can support their family members in recovery and an improvement in their mental health care. The VA offers lots of programs, and even though I work there, it's hard for us to stay up on how many programs that are available to our veterans because we're trying to increase their access to care. So it's constantly changing. But my concern also is for our veterans who need care, physically and mental care, and had been, a member of the Affordable Care Act and having this taken away from them, the impact that this would have on delivery of care to our veterans, such as would increase the amount of veterans coming to the VA who have lost, again, jobs that afford them health care coverage, understaffing, not enough other clinical personnel to support the veterans on their road to recovery, even in mental health. We need physicians, we need psychiatrists, psychologists, nurse practitioners, surgeons. All of those disciplines are at a shortage in the VA. But COVID is also impacting on the hiring process. The other thing that COVID is doing is infecting many of the healthcare workers due to lack of personal protection equipment. Mm-hmm. So there is a multitude of things that are occurring, and the very thought that someone would try to dismantle the ACA in a time of a pandemic when our veterans will need more health, social support is unconscionable. Because we don't really, as Americans, don't really realize the amount of veterans that do get care under the Affordable Care Act.
Yeah, that's really, those are some remarkable comments that you're making. And our veterans deserve better, right? Especially during a time where we have a crisis going on with this pandemic. And is there a number that they can call? Because you were mentioning a call-in number and then also a website that people could go to just to start finding out about these benefits, even if you're a family member. Mm-hmm. The
VA has all of that and is listed on the VA homepage.
Okay.
And it depends on what area that they may be seeking care from. So in the Chicago area, we have 3 VAs. We have Jesse Brown, we have Hines, we have North Chicago.
Okay.
We have other VAs in Danville, Indianapolis, several around the immediate area that the veterans can seek care from. So they just need to go online, and it's very easy, and to get that information as to which VA they want to seek treatment from.
Okay, so they just go to something like va.gov or that kind of site. Okay.
Yes.
That's fantastic. And then, sometimes, you were mentioning before about, veterans feel isolated, fearful, and, especially if they're underinsured or, uninsured. And, what do you have to say to them? Because right now there seems to be this tendency to think that social isolation means social disconnection or, that you don't have anyone you can reach out to. There's no sort of bonding that goes on during this time period because everyone's being told to stay home, and the social isolation and social disconnection is being misconstrued as social distancing. But there is still, a way for veterans who have mental health care needs to reach you, right? And
yes. We do. We're supporting our veterans through telehealth. Some of them have Zoom meetings. AA is offered under Zoom meetings. There are several IP access to the veterans. Majority of them do have phones that they can use to connect to these programs. And even the veterans that I serve, we constantly talk about staying in connection with their families through Zoom, through FaceTime, through other social medias that they want to access. So we're trying to educate them and family members and the public on how to keep our veterans connected. Those are all good ways for them to stay a family, to reach out to their veterans. And it's a good way to avoid contact and infection with COVID is through telehealth and a lot of the social media that is offered now.
Oh, that's fantastic. This sounds like a lot of great resources that the VA system has. And, one of the things, too, is that there is a, tendency sometimes for people not to realize how important it is to maintain the use of their medication. So we know things like diabetes, is an increased risk factor, for people who do develop COVID-19, that it can make you have a worse outcome. And then we also have, one of the things that's suggested as a possible link also to a worse outcome is high blood pressure. And so, maybe if you can, because I know you're a nurse dedicated to making sure people are covered with their medical care. And what would you say to people about making sure they take their medications, and if they need emergency services, to make sure that they seek that by going to the, emergency department if necessary?
Yes, our veterans are encouraged and should seek out care through the VA and through our emergency department. We are there for them. We have COVID testing available to them. But many of our veterans also get a mixture of health care from VA and non-VA sources. And so by making non-VA insurance more available to the patients, such as the ACA, then that leads to them to having better outcome. If they're diabetics and they need medication, the VA will mail that medication out to them. Mm-hmm. However, they can come to the VA to pick up medication also. The one thing that the VA has now instituted due to COVID is that the veterans will have to have identification, and they are allowed to come in to get the services that they need, and then they will, have to leave. So if they can correlate their visits for, say, diabetes, and then they have to see a practitioner for blood pressure management, mm-hmm. perhaps they might want to schedule those all for the same day. We still have walk-in clinics for them. So if they are veterans and they are seeking medical care, then we cannot emphasize it enough, we do want them to come to the VA as quickly and as early as possible, because we do want early intervention so that their outcome and recovery will be better.
Yeah, that makes all the sense in the world. Sometimes we just wait too long to take care of the things that we need. And then also, it brings up another issue, when you're talking about the ACA and then we start talking about VA coverage and all that. It's pretty important, I think, right, for people to come in to get their coverage. I know at least I got a letter in the mail as a veteran, saying that the enrollment period is coming up for TRICARE and that kind of thing. and making sure that people are cognizant of that and making sure that they do their necessary paperwork as veterans, and then looking at their benefits, right?
Right. They should review their benefits. A lot of things are now available online to the veterans, but if not, again, they can reach out to Veterans Affairs, and they will have staff available to answer these questions. We do have social workers there at the VA that are actively there to support our veterans. We have, I know at Jesse Brown, they have signs up now that try to educate the veterans on what's available to them. We have pamphlets that we can give to them so that they can take their time to review this. But having health care now is so important, much more important than ever. I guess it's always been important, but I think we're all becoming more aware of the importance of having adequate health care, follow-up, staying on medication, staying connected to your primary care doctor. I try to encourage all our patients that are leaving my unit to make sure that they have a primary care doctor signed up with before they leave the unit.
Okay, because I'm a doctor, but I grew up in a family of nurses, so I'm so proud of what you're doing, and I really love the service that you're providing for our veterans in our country. So give me a little bit more of a background on National Nurses United and how you're playing a role in this whole process, because it sounds like you are very much on top of all the services that are available through the VA system. But it sounds like you're doing much more than that. You're stepping out and doing things that really matter to our veterans.
Well, National Nurses United is an organization that our primary goal is to advocate for our patients. And so it's always about having a voice in patient care, how it's delivered. Most recently is to make sure that the nurses have proper protective gear. Even today, we had provided by NNU a class on the gear, how to wear the gear, what is effective, what's not effective.
Yes.
And I did see the other day, I was watching the news, and I reached out. There was a news person that had on a mask, but I could see through the mask. So I want to point this out to all of our listeners, is that you breathe COVID in through your nose, you breathe it out through your mouth. If I can or anybody can see through that mask is ineffective.
Yes.
If a mask that you're wearing is clogging up your glasses, that means that the air is escaping, and that you either need to maybe double mask or get a mask that's more effective. I know some of the masks can be expensive, but I myself will double mask in areas like if I'm going to the grocery store or something. Make sure that your mask is not soiled, that it's not wet. All these things. And we try to educate our veterans every day on the importance of this. And NNU has been very, very vocal in making sure that personal protection equipment is available to all healthcare providers. Because if we are stricken with COVID, then that will impact the number of staff that is able to care for our veterans. So personal protective equipment is very important, and then you will be writing letters to our representatives to share with them this educational material and to emphasize to them how important it is that we have this equipment to be able to care for the American public.
Fantastic. So wear a mask, make sure you socially distance at least 6 feet, and wash your hands. That sounds like a nurse's recipe for success. And you have decreased my fear as a veteran about coming forward. And, the socially isolated and fearful person should realize that, social distancing doesn't mean social isolation or that you are socially disconnected from care. So this
get out and walk and get fresh air, and but what you have to do is practice safety. And when you see the people who don't have masks, then stay away from them. We know, we've been through this before. We've had other viruses. We've gotten through this. As a people, we will get through this. But we just have to make sure that we understand the science behind our safety. And that science includes wearing a mask, social distancing, like you state, just having that footage away, 6 feet. So that's usually about 2 arms length. And I tell people it's like being at the ATM. You always want to give people space. There's no difference with COVID. Give it space.
Yes.
That way it will decrease the likelihood that you may become infected. If you have people coming into your circle, friends or families, and they don't have a mask on, then offer them one or separate yourself from that. I did see a picture the other day. Someone was showing me a picture of their newborn child, and I noticed that one of the people that was holding that child did not have a mask.
Oh, boy.
And they said, we're family.
That's not good.
But family will infect family. I mean, it's known. It's scientific. So just be conscious of that. If you have family members that have to go out for whatever reason, which we know life still has to go on, then mask up.
Excellent. Well, we're running out of time, and I just want to thank you so deeply, our Adelena Marshall. If I need a nurse, I'm coming to you. So the VA employee and mental health.
I'm forward to seeing you at the VA. We're more than happy to have any of our veterans there.
Yes.
One thing I do have to stress is that our VA nurses, NMU nurses, are so committed to our veterans.
Yes.
I mean, it is very obvious. If you walk in my shoes, you will see.
Yes.
That's the most proudest moment I have is to have our nurses and see them.
Yes, I do. Okay. Thank you, partner, National Nurses United. And we will have you back, Adelena. We love you. Okay.
Thank you.